Let's talk about the active stage of labor. Now, the active stage of labor, that's when things are really starting to kick up. That's when the pain really starts to peak, and that's the kind of thing where you hear about women just really getting out of control with pain. And in active stage, that's basically from 4 centimeters until you're completely dilated. And at that point, the dilatation should happen fairly quickly. Now, it still sometimes goes in ebbs and flows, but generally we expect at least 1 centimeter an hour, and usually a lot more than that. During the active phase of labor, your contractions are becoming closer and closer together. They may even be every 1 to 2 minutes apart, and you're not getting very much break between them. The contractions are very, very painful, and they last roughly 30 to 45 seconds each. When you're having them, you're going to do everything you can to breathe through them if you're going to decide to do things naturally, or this would be the time when you'd really want to think about getting your pain medicine. The active stage of labor, we're also going to be wanting to monitor the baby more closely, because as you're contracting harder, it's putting more stress on the baby. Now, babies are built for this stress, and most babies do absolutely fine. Occasionally, though, this is when babies show us that they're tiring out, and so we're going to want to watch the baby more closely on the monitor. Also, this is often when the water will break or when the water will be broken for you. And you may see some blood, and that's normal, so don't be worried about that. Labor is a pretty messy business, so there's going to be fluid coming out, blood, mucus, all kinds of good stuff, and so don't worry about that. We're all used to it. We expect it, so don't be embarrassed when that happens. Most people during this stage aren't really going to be up and walking much. It's really pretty painful and pretty hard to do, and most people are more comfortable either sitting or lying in bed at this point. But this is the big time. This is really when you're getting to complete, and this is when the contractions are really peaking for you.
Medtwice.com